In this video, we are talking about movement blocks for a baby that might limit their progress on milestones. So we're talking rolling, crawling, sitting, and walking. If you haven't tested this on your kid yet and they are struggling with some of those movement milestones, then you're definitely going to want to stay for this whole video while I walk you through exactly what to test. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we provide proactive parents and providers with mini masterclasses so that they can learn the ins and outs, tips and tricks to help their children move better. Think of me as your pediatric physical therapy bestie, here to help you learn what is blocking your child from meeting their milestones. In today's video, we are talking about one of my favorite, also one of the least known things that can be blocking a child from their movement milestones. We're talking rolling, crawling, sitting, walking, and potentially even some of the higher level things. So if you have an older kid, even though I show it on a baby, I've used this motion to test my older kids as well as my infants. So if you have an older kid, you can definitely gain a lot of information just from this video too. So what is a movement block? I like to think of movement blocks as anything that is limiting a child from achieving their movement milestones. So with a rolling specifically, we want babies to roll over their back to their belly, over their left arm and their right arm. We want them to roll belly to back over the right arm and their left arm. If they're only able to do one of those directions, maybe just back to belly, but not belly to back, or they're not able to do back to belly over both arms and belly to back over both arms, then something is blocking that movement. Oftentimes you're told as parents not to worry about it, but the truth is, with a little bit of information and some time and intention on your part, there are so many things that you can do to help your child actually achieve those motions. You just need to figure out what is blocking them. With sitting and crawling as well, you're looking at these same movement blocks, but maybe in different directions. In today's video, we are talking about the rotational plane. So we want babies to move in 3 planes. We want them to go forward, backwards, we want them to go side to side, and I'm a little teapot, and we want them to be able to rotate the top half of their body in both directions, and we want them to be able to rotate the bottom half of their body in both directions. When a baby does not have one or more of these movement planes, their movement is blocked in that plane. And today we're talking about rotation. So we want the baby to be able to bring the top half of their body to the right and the top half of their body to the left. Now you can also look at a couple other videos on this channel to look at full body rotation. But this video, we're only talking about the top half of the body moving on the bottom half of the body. I do have one other video that shows this motion in a different baby in a slightly different way, but I wanted to make sure I had this specific style because this is the one that I do the most. So since I'm talking such a wide range of parents in this video, I want to make sure that you have the next step resource that is specifically right for you. If your baby is struggling with rolling, we want to make sure you have the full comprehensive answer to any and all the things that could be going on with rolling. So my book, Tummy Time and Learning to Roll, is going to cover 0 to 6 months all the way through rolling, and that is going to be the best resource for you guys, for anyone who's struggling with rolling. In the description, there will also be a rolling checklist, free download for you to go through. That's going to be the beginning steps. The checklists are also in the book. All of the books will be linked in the pinned comment as well as in the description. If your baby is struggling with sitting, the next best resource is going to be my next book, Learning to Sit. This book is going to be for kids 4 to 9 months. It goes through sitting with the hands and sitting without the hands. So we want to make sure a baby is able to sit super fluidly before they move on to their next one, which is learning to crawl. Now, learning to crawl is not out yet, but you can download the free crawling checklist, and I will update the description and pinned comment with the link to learning to crawl once it's available. The learning to sit also has a checklist as well, All of them will be linked in the description. And then if your kid is working on walking, there is a learning to walk checklist that you can also download. We really just need rotation, guys. No one talks about rotation. No one talks about mobility in children. It is crazy. It makes me Looney Tunes, but that's why I have this channel, so I can spill all the tea for you guys on baby movement. So let's get into how do we rotate and how do we test rotation so that you guys can check to see if your kids have what they need in that mobility department, and if not, what to do about it. In this view, you guys are gonna see me place the baby between my legs. We want the baby's pelvis to stay on the floor. My hands are gonna go at their trunk at nipple line, and I'm just going to bring their shoulders and their trunk in rotation to the left first, and then I'm going to go to the right. I'm only going as far as the baby allows me to go. You can see there that they kind of kick out of going to the right, and that going to the left was a little bit more tolerated. We're gonna go through this one more time so I can make sure that you guys really fully understand. I'm only going to the level of the resistance. A baby with full range would be able to get both of their hands to my leg. And so you can see that while this baby tolerates going to the left more, and that would be their easy direction, they are pretty limited in both directions. And so I would want to work on rotation with this baby specifically. If their bum lifts up off the floor, then you are going to stop, because that is how much range the baby has. If their butt lifts off the floor, they are using their pelvis instead of just their upper trunk. So you can see in this view that they're forward facing, and so my hands are lightly, really gently, and I'm going to the right, and he just doesn't love it. Like, look at his cute little face. He doesn't love it. But once I go to the left, he starts looking up at me. He can go a little bit further, and if he needs a break, I'm gonna give it to him, and then I'm gonna try again. So he can go a little bit further. That right arm gets a little bit closer to my left leg than his left arm does when I go to the right. He really seems to fight that direction. And so when doing any positional releases, I'm gonna focus on this baby specifically on the left side, but for your baby, we want to focus on whatever direction the baby goes the furthest, which is typically the easy direction. So here are a couple of ideas on how you can use this position specifically in order to improve the mobility. So we are going to use the total motion release style of improving mobility. So if that is new to you, make sure you check out the TMR playlist, because I won't have enough time to go through all the things in this video. So one of the ways you can utilize that is to actually keep them in between your legs. Go until where you start to feel the resistance. That's going to be the end of the range. And hold that on the easy side only for 2 to 5 minutes. You're going to want to follow all of these exercises up with bouncing, holding the baby on your knee, horsey ride, bouncing for 30 seconds to 1 minute to lock everything in. You can also bring them to the easy side as a repetition. Place toys on the side of the child, and you're gonna bring both their hands to one side if they're able to tolerate and go that far. If not, bring it towards like the knee, and that is gonna allow for increased repetitions if the hold is too difficult. You can also transition them from sitting to their belly. There's tons of videos on the internet on transitions, but basically you're going to go from sitting, both arms are gonna come to one side, and then you're gonna swoop their legs out from underneath them. And then you can also have them transition from sitting to all fours. This is going to be better for the babies who are kind of crawling to walking. Bring both hands to the side, or have them bring both hands to the side while in side sitting, and then help them rotate their pelvis over into all fours. Then bring them back into sitting and do that 5 to 10 times to the easy side only. And then you can also complete the upper trunk / lower trunk twist, which is a positional release where you hold the baby in that position 2 to 5 minutes. It's in the the TMR playlist, which will be linked at the end of this video, as well as in the description. And you can do that hold position again to the easiest side only for using the TMR protocol. And that's a wrap, friends. Thank you so much for taking time out of your busy schedule to learn with me how to help your child move better. If you have additional questions, make sure you check that very full pinned comment, because you're gonna find a link on how to schedule a one-on-one online parent consultation with me, where we can talk about what's going on with your little and some next best steps for you so that they can master their milestones. And as a reminder, if you do want the all-in-one solution for rolling and sitting, make sure you grab a copy of Learning to Sit or Tummy Time and Learning to Roll, both of which will be linked in the pinned comment and description. If you're looking for more motion, mobility things, make sure you check the TMR playlist. That is going to be the best place for you to find more information. Make sure you watch all the videos to the end so you really soak up the knowledge and why this is important, what could be holding your child back, and resolve those movement blocks.